This
To
conference will
today's
now be recorded.
small group health plan rate review. We've got HealthNet and sorry, we got Bridgespan, Regence, and Samaritan today. I'm on the wrong page. And Ethan, you're on the line, correct?
Yep, I'm here.
All right, I'm going to hand it over to you.
Sounds good. Thank you, Steve. On behalf of the Department of Consumer and Business Services, Division of Financial Regulation, my name is Ethan Baldwin, and I welcome you to this public hearing to discuss the Division's preliminary rate decisions for 2021 health benefit plans. The Division holds hearings on all individual and small group rate filings. Each hearing is generally limited to discussion of the Division's preliminary decision and final objections regarding the filing. During this time, carriers will be permitted to defend their assumptions using information submitted in the filing or indicate agreement with the findings. Carriers may not introduce new information or propose new or revised assumptions at this time. When reviewing a rate request, Division actuaries consider such factors as recent and projected medical care and prescription drug costs, including any benefit changes, past and future loss ratios, that is how much of every premium dollar goes to pay healthcare claims costs. This is to ensure the requested rate is not projected to trigger federal rebates or payments from other federal programs. The Division actuaries also review the recent history of rate changes and the overall financial strength, including profitability, investment income, and surplus of the company, as well as administrative costs. Division staff also ensure that the filings meet all requirements of the Affordable Care Act and determine whether or not the anticipated number of enrollees will adversely affect an insurer's financial position. You can review the full rate request for all companies on our website at www.oregonhealthrates.org. All communication for every health insurance rate change filing, including written answers to all questions asked during the review period, are posted there as well. In this morning's hearing, we're discussing in this order the preliminary rate decisions the Division has made on individual and small group health benefit plans filed by Bridgespan Health Company, Regence BlueCross BlueShield of Oregon, and Samaritan Health Plans, Inc. Our agenda will be representatives from each company describing their requests. Then Division staff will lead a discussion about the Division's preliminary decision on each filing. Finally, we will accept public testimony. If you'd like to make a comment on a company's filing, please unmute at the right time when I announce it. Introduce yourself and make your comment. Comments will also be accepted online through 11:59 p.m. on July 8th. The Division will make a final decision about these rate filings shortly after the public comment period ends on July 8th. We'll begin by allowing Bridgespan to introduce himself and explain their rate request.
Thank you, Ethan. This is Paul Harmon. I'm an actuary with Cambia Health Solutions, which is the parent company of Bridgespan. My role is Vice President of Actuarial Pricing, and we appreciate the opportunity to be here and discuss our 2021 proposed rates for Bridgespan. As I said, Bridgespan is an affiliate of Cambia Health Solutions, part of Cambia's family of insurance companies, and offers health plans on Oregon's health exchange. Next year, we will see a continued expansion for our service area with statewide plan offerings. We applaud the state for taking steps to stabilize the market and helping make this continued expansion possible. Our health plans include tools to help estimate treatment costs, along with other resources that help consumers manage their health, including various virtual health options. Our filings reflect what we expect care to cost in 2021, with rising medical and prescription drug costs continuing to put pressure on rates. We have not included any adjustment for COVID-19 costs due to the many uncertainties of the pandemic and its impacts on care, and appreciate the state allowing more time to assess these impacts. So thank you for this opportunity. I'm going to hand it over to another actuary with Cambia, Sophia, and she'll introduce herself and walk through Bridgespan's rate request. Sophia, it shows you unmuted, but we can't hear you, or at least I cannot hear you.
See here. Yeah, show her unmuted.
Sophia, if you'd like to maybe try and call in again, there might be some technical difficulties here. Maybe hang up and try again and see if we can catch you.
Can you pause for a minute?
Okay, I'm not getting any response from Sophia, just through our own company's instant messenger. So just to keep things moving, I can introduce a different actuary who is hopefully computer is working, Dan, and he can walk through the request.
Great. Getting called in from the bullpen. My name is Dan Bader, and I am also employed by Cambia, working in the actuarial pricing department. This filing is discussing the Bridgespan individual ACA compliant plans impacting 3,072 members. The average annual increase proposed is 11.1%, and the minimum and maximum increases are negative 3.2% and 16.4% respectively. We are not adding any new plan designs for 2021, and the following plans are being discontinued though. The Silver HDHP 3500 EPO, the Silver Essential 4000 EPO, the Bronze HDHP 6000 EPO, the Bronze Essential 7500 EPO, and the Bronze Care on Demand 8000 EPO. In 2021, we are introducing a new accountable health network with Legacy Health Partners, which is being offered in Multnomah, Washington, and Clackamas counties. As we do each year, we have reviewed and revised our area and product factors with the rate filing. And since the original filing submission, no changes or requests have been made to the rate filing.
Great, thank you. Division staff will now lead a discussion about the division's review of the filing and preliminary decision.
Hi, my name is Drew Bucks. I'm an actuary with the DFR, and I'm the primary reviewer for this filing.
Hi, this is Tim Hinkle. I was the secondary reviewer on this filing.
Hi, and this is Tasha Sizemore. I'm the Life and Health Program Manager.
Hi, TK Keene, Deputy Administrator with the division.
And so our job at the division is to look at the rate filings and as the actuary, review the filing.
Yeah, and sorry, my apologies, Lou Savage, Administrator for the division.
Okay, so the actuary's job here, our job is to review the filings for the accuracy of the calculations, appropriate data, and reasonable assumptions. And after we've done that for this filing for Bridgespan, our preliminary decision is to approve the 11.1 rate increase. So I'll go through a couple things that we reviewed for this filing. We reviewed the trend for this company by itself and in relation to the market wide, and found the trend to be reasonable. The risk adjustment calculations that were both done by the company and they were consistent with market-wide assumptions, again found to be reasonable. The final 2019 risk adjustment numbers have not yet been released, but we will review them when they are published. The reinsurance calculations, we found them both to be reasonable for the company and consistent with the market-wide assumptions. Administrative costs, taxes, fees were appropriate and within allowable levels. We have reviewed the calculations and verified them to be correct. And again, that leads me to, again, say that we are our preliminary decision is to approve 11.1%.
Thank you, Drew. Bridgespan, do you have any additional information? Oh, go ahead.
Oh, hi. This is Tim Hinkle. I just wanted to just ask a real quick question out to Bridgespan, and that is, we requested some additional information regarding any COVID impacts or any new data that you might have. Is that something that you have available now that you can speak to?
And I can speak at least generally to it, Tim. Yes. And so one of the questions that had been asked was just the latest emerging data and relative to any original estimates, both looking at 2020 and 2021. And the uncertainty remains a pretty big piece of what we're dealing with. All the emerging data really changes on almost a day-to-day basis. Like many carriers, or at least what I'm assuming, like many carriers, we did experience less claims than what we would typically see, as people didn't avoid care necessarily, but just that leaving the house, going out and going to providers was not occurring. More recently, we had seen those return, not all the way back to what we would describe as normal levels, but approaching something pretty similar to that. What sort of gives us pause right now is the latest increase in cases that we've seen, and particularly what that means for us, and cases being COVID-19 cases in particular. The cost of treating those cases has continued to go up for us from what we've seen, and so far that has been offset by the non-COVID-19 care that has been reduced from those normal levels. And so what we're particularly curious, interested in looking at as July continues is the non-COVID medical care continuing to return to its normal levels? Or does this increase in cases sort of offset that? And I think that's the biggest piece for us that we're monitoring in this next 2 weeks, to really see both for just current costs, but for what we might reasonably anticipate as we deal with COVID-19 into the fall and into next year.
Okay, thank you. Is that something that you'll have in writing in SURF for us?
Yes, it is. And in particular, as we move in the next week, and particularly the next week and a half, that we can put some numbers behind that as well. So not just a narrative.
Okay, thank you. Go ahead, Ethan.
Well, yeah, thank you, Tim. Bridgespan, is there anything else you'd like to say at this time in regard to the preliminary decision?
Probably just a quick comment to give some context around the 11% increase. And a premium increase is typically due to one of two things, just an expectation of higher cost of care, or an expectation that the plan offerings will require less out of pocket for the people who choose them. And so if you look at Bridgespan's filing for this year, there's a mixture of plans that are renewing, and so that a member who is renewing on that plan will have a fairly similar experience, that it's basically the same plan design with some modifications for AV calculator or other reasons. And then we have members who are being mapped to a new plan design. And so in that case, it's fundamentally a different plan than they had in previous years. And so what you will see for Bridgespan this year is that the renewing plans, and these are the Oregon standard plans, for the For the gold and the bronze, they're actually seeing small decreases or rate passes. For the standard silver, they're going to see something around 6 or 7% of an increase. Where the larger rate changes are coming from are from those plans where we are mapping individuals to new offerings. And so the difference between those decreases on the standard plans up to about a 7% increase on a standard plan is that for the most part, the members who are being mapped to a plan that offers richer benefits, so more expansive coverage. And so the premium increase is often double digits on those, 11, 15 and higher. But that's with an expectation that the average consumer would have less out of pocket by moving to those plans. And so the average Bridgespan consumer will see an 11% increase in premium. But a piece of that for those mapped members is also with relatively more comprehensive benefits than the plan they were on in 2020. Otherwise, we appreciate the department's review and no other comments.
Thank you. We will now take any public testimony. Please unmute and introduce yourself. All right, it sounds like no one signed up to testify, so let me remind everyone listening that July 8th is the last day for public comments. They can be submitted through our website, www.oregonhealthrates.org. Next, we will hear from Regence. We'll pause for just a moment. And now we'll go ahead and say, Regence, please begin by introducing yourself and explaining your rate request.
Thanks, Ethan. This is Paul Harmon from Cambia. I'm the Vice President of Actuarial Pricing, and we appreciate the opportunity to be here and discuss our 2021 proposed rates for Regence BlueCross BlueShield of Oregon. We are a tax-paying nonprofit health plan and have been offering quality health insurance in Oregon for 79 years. The big news for 2021 is that we are expanding our presence in the individual market. We will be joining the exchange and providing coverage statewide, offering consumers additional health plan choices. We applaud the state for taking strategic steps to stabilize the market and helping make this continued expansion possible. We continually strive to offer members the most value for their premium dollar and take great care in estimating rates that accurately forecast expected costs. Our filings reflect what we expect care to cost in 2021. The cost of care remains high, and medical and prescription drug costs continue to drive rates. We have not included any impact for COVID-19 costs in the initial filing due to the many uncertainties of the pandemic and its impact on care, and appreciate the state allowing more time to assess these impacts. As always, Regence remains focused on maintaining financial stability, ensuring we can protect our members and pay their claims today and in the future. Oregon is our home, and we remain committed to serving Oregonians for the long run. Thank you, and I'm going to introduce another actuary, Sophia with Cambia, and she will walk through Regence's specific rate request.
Thanks, Paul. Hopefully you can hear me.
We can hear you.
My name is Sophia Ling. My name is Sophia Lingy, an actuary at Cambia, who worked on the Regence BlueCross BlueShield of Oregon individual filings for 2021. Regence BlueCross BlueShield of Oregon will be offering the product with an average annual increase of 2.5%, with ranges of increase from -5.2% to 6.7%. The number of members impacted in this filing is 3,166. The standard gold plan EPO has been added to the portfolio, and the silver HSA 2700 OHSU plan has been discontinued. However, we are adding an accountable health network with legacy health partners, and this is being offered in Multnomah, Washington, and Clackamas counties. The only changes were to benefit and area factors that have been revised since last year, and there have been no changes since this filing was submitted.
Thank you. Division staff will now lead a discussion about the division's review of the filings and preliminary decision.
My name is Drew Bucks. I was the primary reviewer for the DFR.
Hi, this is Tim Hinkle. I was the secondary reviewer on the filings.
My name is Tasha Sizemore. I'm the Life and Health Program Manager.
TK Keene, Deputy Administrator with the division.
And Lou Savage, Administrator for the division.
And so after careful review of the filing for the accuracy of the calculations, the appropriate data, and reasonable assumptions, our preliminary decision is to approve the 2.5% rate increase. And so a few of the details that led us or supported our decision to approve this rate increase were we found that trend was reasonable for the company itself and consistent with the market. Risk adjustment calculations were both reasonable for the company and again consistent with the market. Reinsurance was reasonable for the company and consistent with the market. Administrative costs, taxes, and fees were appropriate and within the allowable levels. We reviewed the calculations and verified that they were correct. And for risk adjustment, we haven't seen the final 2019 risk adjustment numbers, and we'll review them when they are published. For these reasons, we are, again, our preliminary decision is to approve the 2.5% rate increase.
Thank you, Drew. Regence, do you have any additional information or comments you'd like to make?
Sorry, Ethan, I was unmuting. Not at this time.
All right. I'm sorry, did we do both of those, both small group and individual, or do we need to do?
We need to do small group.
Sounds good.
We
That's
can
what I
introduce
thought,
that.
but
Okay.
just wanted to confirm.
All right. Dan, are you available to introduce small group?
I am.
Thank you.
My name is Dan Bader, and I'm an actuary employed by Cambia Health Solutions, parent company of Regence BlueCross BlueShield of Oregon, as part of the actuarial pricing department. The following 2021 filing information is for Regence BlueCross BlueShield of Oregon small group ACA compliant plans impacting 72,038 members. The average annual increase for groups renewing in Q1 is 5%, while the minimum and maximum increases are negative 1.4% and 8% respectively. This filing also proposes quarterly increases of 1.8% for the second, third, and fourth quarters of 2021. We are not adding any new plan designs, nor have any plan designs been discontinued for 2021. And an accountable health network with legacy health partners is being added and will be offered in Multnomah, Washington, and Clackamas counties. Additionally, as part of our annual review, we have revised area and product factors with this filing. And since the original filing submission, no changes or requests have been made to the rate filing.
Thank you. Division staff will now lead a discussion about the division's review of this filing and preliminary decisions.
And so much of the same review we performed, but on a small group basis. Reviewing the filing for accuracy of the calculations, we looked at the data and assumptions and determined the reasonability. And for those reasons, we have our preliminary decision is to approve the 5.2% rate increase. Some of the things that we looked at while reviewing this filing were the trend, which we found to be reasonable for the company and compared to market-wide was consistent. Risk adjustment calculations were both reasonable. for the company and consistent with market-wide assumptions. Again, we have not received the final 2019 risk adjustment numbers, but we'll review them when published. The administrative costs, taxes, and fees are appropriate and within allowable levels. And finally, the calculations were verified and determined to be correct. And so for these reasons, our preliminary decision is to approve the 5.2% rate increase.
Thank you, Drew. Regence, do you have any other additional information or comments you'd like to make at this time?
Yes, this is Paul again, and this applies for both the individual and small group, and just wanted to update on how we're viewing the COVID-19 and the potential costs of the pandemic. And so, as I said in the opening, in our filings, we haven't included an adjustment to date, and that was largely a reflection of the uncertainty at the time of filing, and that uncertainty remains. We have learned a lot. We do see continuing trends on a day-to-day basis. Like most carriers, we saw a reduction in non-COVID related claims due to self-quarantining and other social distancing reasons. In the past couple of weeks, we have seen claims start to come back. We've seen them approach sort of what we would consider normal for this time of year. But the big piece that we're monitoring and really concerned about or interested in watching is the increase in cases that we've seen in Oregon and what that may mean both from the cost of COVID itself and sort of that related impact to other services. We're continuing to analyze that and committed to providing the division a written update in the next week or two to sort of share our latest view on things and just give the division the latest information we have. No other comments besides that, though.
Thank you. We will now take any public testimony. Please unmute and introduce yourself. All right, hearing no testimony, I'll just remind anyone listening that July 8th is the last day for public comments. They can be submitted through our website, www.oregonhealthrates.org. Next, we will hear from Samaritan. We will pause for just a moment. And now I'll ask Samaritan to begin by introducing themselves and explaining their rate request.
Yeah, hi there. This is Trent Began, Director of Finance for Samaritan Health Plans. With me are Kelly Grabinski, Senior Consulting Actuary, and Bridget Quest, Manager of Product Development. Just trying to verify you can hear me okay?
Yes.
Okay, thank you. So I'm here to present the small group filing for calendar year 2021. So to start off, Samaritan Health Plans has always been about building healthier communities together. That's our mission statement. So to that end, we're going to be leveraging our strengths in our regional network. And what that means is we'll be moving out of statewide plans and going into more of an exclusive provider organization, EPO, in our 3 counties. This is going to really, it might, cost some change for some of our members, but I think it's a great benefit for our communities in our 3 counties and for the state of Oregon, because now we can really leverage our network costs that we've built up over the past few years in our region. We're a tightly integrated health system with Samaritan Health Services, and we're also we've got a great PCP care home network in this region that we've been building up over the years as well. So we're really leveraging our strengths, applying that to the small group market. And so I believe that the members that are able to stay with us are really going to benefit both from a health outcome perspective and from a cost perspective. So with the numbers here, for 21, by going to an EPO network, our average rate increase is only going to be 0.1%. So that ranges from a minimum of a negative 3.1% rate reduction up to a maximum of a 2.7 increase. This is based on an annual trend rate of 6.1%, which is really going to be spread out over 1.49% each quarter. We currently serve 690 small group members right now, over 24 benefit plans. We'll be scaling back. We'll be probably reducing by about 340 members to a smaller group. And because of that, we are reducing all of our statewide plans, but we are adding 13 EPO plans. One of them is platinum, 8 gold, 3 silver, and 1 bronze. With that, I would like to thank the division for preliminary approving our small group rates. And I'll leave it open to see if Kelly Grubinski has any comments as well.
Thank you, Trent. Really, the only other comments I will make are that as compared to the 2020 small group rate filing, the only rate factor changes that we made were an update to the annual trend factor based on most recent experience, adjustments to our plan adjustment factors to account for leveraging of deductibles and the implementation of the new EPO plan designs. And we also updated area factors for 2021 based on a current study of Samaritan's commercial group business by region. Those were the only additional comments I had.
Thank you. Division staff will now lead a discussion about the division's review of the filing and preliminary decision.
Hi, my name is Drew Bucks. I was the primary reviewer for the DFR.
Hey, my name is Tasha Sizemore. I'm the Life and Health Program Manager.
TK Keene, Deputy Administrator with the division.
And Lou Savage, Administrator for the division.
And so after careful consideration of this filing, reviewing of the accuracy of the calculations, ensuring appropriate data was used and reasonable assumptions, the DFR is, our preliminary decision is to approve as modified the 0.1% rate increase. And now I'll go through some of the support that shows why the 0.1% rate request was determined to be reasonable. One of the things that we considered was the Samaritan small group membership is limited for the experience period and therefore doesn't have much credibility. The rate development that was used was the 2019 self-insured experience, and there were adjustments applied to arrive at the final 2021 rate for small group on an EPO network. So the adjustments that we reviewed and determined reasonable were the trend, morbidity adjustment, industry adjustment, and one of the bigger adjustments was the provider network contract changes, which adjusts from a PPO network to EPO. The risk adjustment calculations, we determined them to be reasonable for the company and consistent for market-wide. The administrative costs, taxes, and fees were appropriate and within the allowable levels, and the calculations have been verified and determined to be correct. For these reasons, our preliminary decision is to approve the 0.1% rate increase. And I just wanted to add that this company does include a 2.5% adjustment for COVID. So have there been any changes or do you have answers to the questions that we submitted last week?
This is Kelly Grubinski. We have been continually reviewing the data as it comes in with respect to COVID, as well as developments that are happening in the marketplace with respect to changes in the number of cases, hospitalizations, and ICU admissions, as well as progress on both vaccines and potential prescription drug treatments. But as of this time, we don't have any more information than what we provided last week.
Okay, thank you.
Samaritan, anything else you'd like to add at this time?
No, we appreciate doing business in the state. So thank you.
Thank you. We will now take any public testimony. Please unmute and introduce yourself. All right, doesn't seem like anyone signed up to testify, so let me remind everyone listening that July 8th is the last day for public comments. Comments can be submitted through our website, www.oregonhealthrates.org. Thank you, and that concludes this morning's hearings.
Thank you, everyone.